All right, so I'm gonna take a break from setting up experiments that I'm gonna run in my lab this afternoon so that I can record the video that you all asked for. And so one of the biggest things that came up was, could you talk a little bit more about muscle actions? One of the other things that came up was, can you talk about the lower leg? And that's exactly what we're gonna do in this video. So I have here on my desk a leg, and in particular, we're gonna focus on the anterior part, the lateral part, the posterior part, and then the really deep, strong magnets, the really deep posterior part. Go through all the muscles that you need to know, how to learn their actions, and hopefully that'll be helpful for you all before our practical. All right, so let's put this camera on a tripod and let's look at this leg model together. So when you're looking at one of these leg models, I think the first thing you need to do is establish what is medial, what's lateral. The easiest way for me to figure this out is by looking at the big toe and looking at the pinky toe, right? Our big toe is always going to be on the medial side. Our pinky toe is always going to be on the lateral side, so that gives you some orientation. Now, if you look and rotate really quickly, you'll see that there is your tibia, nice little bony structure. You can actually feel this on your own leg if you feel around for it. But the first fleshy part right next to the bone that you feel right here, that's going to be your tibialis anterior. So if we bring it a little bit closer and look at those muscle fibers, tibialis anterior has muscle fibers going up and down. Okay, let's look at other muscles that we need to discover here. This big one that we can take off, we don't really have to because there's nothing we need to see underneath it, but this big muscle right here, notice where its tendons go, right? Its tendons go to the digits, okay? So that is one clue. The second clue is, because you have tendons here and muscles will pull the tendons, what's gonna happen to your toes, right? If you pull on these tendons, your toes are gonna extend, right? So these are, this muscle is going to be an extensor. So to give it its full name, it is extensor digitorum, because we're going to the digits, longus. There's a brevis, but you don't need to know that for this class. Okay, and as we rotate around, there are two more sort of anterior, maybe even more lateral muscles that we see right here. I'm gonna have to zoom in a little bit to see the detail, but first of all, I just want you to notice the big chunky muscle that goes like this. This is going to be your fibularis longus, and then notice the muscle fibers. Muscle fibers are basically going straight up and down, right? So fibularis longus, how do you remember that? Because it's on the lateral side where your fibula is, right? So if you know where your fibula is, you'll know where the fibularis longus is. So then how do you find the fourth muscle here that is the fibularis brevis? Well, let's just try to zoom in, and do you see right here? Let's use a stick. Right here where the muscle fibers start to go at an angle. That's actually a separate muscle than the fibers going up and down. So this is fibularis longus. When you start to see muscle fibers go at an angle, that is your fibularis brevis. All right, so those are the four anterior/lateral muscles of the lower leg you need to know. Let's quickly talk about their actions before we move on. So tibialis anterior, if you look to see where this tendon is actually going, it actually goes here to the side of the foot. And when this muscle shortens, it's gonna pull on this tendon, and that is basically gonna cause dorsiflexion of the foot. Right, so if you can imagine, I'm gonna pull over here, there's a joint right there, it's gonna cause the foot to go like that. So that is gonna be dorsiflexion for this one right here. When we're talking about the extensor digitorum longus, we kind of already know what it does. It extends the digits, or it also does this sort of like dorsiflexion, right? And the weird thing is when we actually start talking about the fibularis, the way that these tendons kind of interact pull the foot a little bit differently. They're still going to shorten. They're still going to pull in this direction. They're still going to pull on their tendon, but because of where this is located in relation to the joint, it actually causes plantar flexion, right? So remember, dorsiflexion is like extension of the toes. Plantar flexion is like just normal flexion of the toes. Okay. Now we're going to move on to the posterior leg muscles. And even before we flip this over, I just want you to notice you can see two big muscles from the lateral view, right? So we know this is going to be a lateral view of the gastrocnemius. All of these with the muscle fibers going straight up and down all of that is going to be gastrocnemius. But if you pay really close attention, you'll see there's a little separation right here. Let me see if I can bring it closer. A little separation right here. This is still gastrocnemius. This in between is actually the soleus, right? Oftentimes when we show you the soleus, we're going to pull the gastroc off and lay it out on the table for you, and all of this right here, that's going to be your soleus. But I also just want you to see that if you just look at it from a side view, you can still very clearly see soleus here, gastrocnemius over here. Let's just be complete. If we actually look at the tendinous part over there, that's where you're going to find your Achilles tendon. All right, so that is the big gastrocnemius pulled off. Let's think about what it does in terms of its function. Let's connect it back up and try to see what happens when this muscle gets shorter. When this muscle gets shorter, it's going to pull on this tendon. Where is this tendon located? It's basically going to be connected to your calcaneal region over here. And what that is going to do is cause your foot to plantar flex, right? It's going to go like that. Or actually, I can use this hand, like that, plantar flexion. It's basically pulling on the tendon to do this. So that these two muscles are going to cause plantar flexion. Okay. If we look in the posterior component of the leg and we actually look at the deep muscles, we see 4 other muscles that you need to know, right? Let's identify them. Let's just point them out really quick. This one right here, that's one muscle. This one right here is another muscle. There's a third muscle where you can just see a little bit of it through this tiny little window, but it's actually, it extends all the way down here. And then the fourth muscle has fibers that go in this diagonal direction, crossing this knee joint. All right, you do need to know all 4 of these muscles. I'm going to start with this angle one, this one going up to the knee. It actually does cross over onto the femur and connect on this side over here, and this muscle is called your popliteus. Right? Remember, this is the only one that has this sort of like diagonal muscle fiber direction that crosses the knee joint on the posterior side. Okay? Popliteus. Now remember, I mentioned that we just see a tiny little window here of another muscle. This is actually going to be our tibialis posterior. So just how we had a tibialis anterior, we also have a tibialis posterior. We just see this part of it. Now that leaves us with 2 other muscles, this and this, right? And what I want you to see about these muscles is if you actually look at where their tendons are, they go all the way underneath the foot to the digits and the big toe. Okay, what does this mean in terms of their function? Because that's going to help us understand what these muscles are called. So when we're actually looking at tendons that go to the bottom of the foot, if those tendons are pulled, we get that plantar flexion or flexion of the digits, right? So these 2 muscles, because they have tendons that run underneath the foot, they are going to be flexors, right? The other thing that we can see, they're kind of long, so they're also going to be longus muscles. So these are both going to be flexor longus. The difference between them is one is digitorum, going to the digits. The other is hallucis, going to the big toe. Hallucis means big toe, right? So the flexor hallucis longus is going to the big toe. The flexor digitorum longus is going to the 4 smaller toes, right? These digits over here. Now, how can you tell the difference between the 2? You might think that if one is on this side and one is on that side, that would match up. The thing is, it doesn't, because the tendons of these 2 muscles under the foot cross over. So actually this muscle right here that is on the lateral side, it doesn't go to the big toe. It actually goes to these 4 little toes. That's why this muscle is called the flexor digitorum longus. And then this muscle over here, right, the big obvious one, is not going to go to the digits. It's actually going to cross over and go to the big toe. So that makes this muscle the flexor hallucis longus. All right, so let's talk about actions and functions really quick. The flexors are pretty obvious, right? It's in their name. Flexor hallucis is going to flex the big toe. The flexor digitorum is going to flex the other toes or the other digits. What about the tibialis posterior? The tibialis posterior, because of where it's at, is going to act pretty much like the gastrocnemius and the soleus. So what do these do? These are going to cause plantar flexion, right? So same thing with the tibialis posterior. Now, when we talked about the popliteus, the function is a little bit different, and it has to do with the fact that it crosses the knee joint at this angle, right? So if you can imagine, if we hold the upper leg steady, if all the muscles are contracted to hold this steady, and this muscle contracts, what is that going to do? It's basically going to rotate the tibia about the knee joint in a medial direction, right? So again, here's our big toe, right? If you don't remember, here's our big toe to get some orientation. When this muscle contracts, it's going to shorten and cause this entire muscle to rotate like this. That is a medial rotation of the lower leg about the knee joint. Now, that is not the only action, but if you mention that on the exam, that would be fine. But there's another action that is also kind of obvious here. What if we keep this lower leg stable and instead contract this muscle and see what happens to the femur, to the upper leg? So when this contracts and this is stable, what ends up happening is the upper leg rotates like this, right? It actually does a lateral rotation, going in the opposite way, because that's what happens when you shorten this muscle. All right, well, that was a little guided tour of the lower leg. This muscle model is actually a lot heavier than I expected it to be, so I got a little bit of a workout, but that's totally fine. Hopefully that was helpful. Hopefully you now have a better idea of what the muscles are called, why some of them are called that, and especially the actions associated with them. You kind of want to take the same approach for studying all of the other muscles of the leg and the arms and the trunk and the head and all the muscles that are going to be on the practical. So just make sure you can identify them, kind of know why they're called what they're called if you have the opportunity to do that, and then definitely know at least one of the actions for those muscles. All right, best of luck studying for the rest of the practical. I'll see you all in class.